Hello, I'm Dr. Dan Soular, family medicine physician and Vice President of Medical Affairs at Grand Itasca Clinic and Hospital in Grand Rapids. Here to talk to you about COVID-19. I would like to spend a few minutes to discuss basics regarding COVID-19, update local testing information, what we are currently doing to prepare at Grand Itasca, and what you can do to contribute to reducing the impact of COVID-19 in our area. COVID-19 is a strain of coronavirus that causes respiratory symptoms, including fever, cough, and shortness of breath. The virus spreads from person to person through respiratory droplets produced when an infected person coughs or sneezes. These droplets can land in the mouths or noses of people who are nearby or inhaled into their lungs. It is also possible that a person can get COVID-19 by touching a surface or object that has the virus on it, and then touching their own mouth, nose, eyes, or anywhere on their face. But this is not thought to be the main way the virus spreads. The Centers for Disease Control, or the CDC, recommends everyday preventative actions to prevent the spread of respiratory viruses, such as avoiding people who are sick, avoiding touching your face, and covering your cough or sneeze with a tissue. We also recommend cleaning frequently touched surfaces often, such as doorknobs, faucets, cell phones, etc. People who are sick should stay at home. Workers who are sick should follow CDC guidelines and stay home when they are sick. They should also contact their employers for their current return to work recommendations. COVID-19 is an emerging disease, and there is more to learn about how it's transmitted, severity, and other features, and what will shape how we approach this pandemic moving forward. As of the end of the day, Monday, March 23rd, we do not yet have any confirmed cases in Itasca County. There are, however, confirmed cases in Cass County to our west and St. Louis County to our east. Confirmed cases are updated on a daily basis through the Minnesota Department of Health. At this time, testing is still limited to patients who are sick enough to be in the hospital, as well as to healthcare workers. Once the testing capacity increases and healthcare facilities are able to test more patients, we expect the number of confirmed cases to significantly increase. Even without testing results to support it, we are operating under the assumption that there are people with COVID-19 in our area. This is why we need to take seriously our role in slowing the spread of COVID-19 in our communities. All Minnesotans are encouraged to limit time spent in locations that do not allow social distancing of 6 feet per person. By making healthy choices in practicing social distancing, we can help break the chain of transmission. These community mitigation efforts will allow hospitals like Grand Itasca time to care for patients with our available resources and help reduce a potential surge that could overwhelm our healthcare system. Our hospital and healthcare providers are trained to manage infectious diseases, including new outbreaks such as COVID-19. Our current understanding of COVID-19 suggests that most people who become infected will not become seriously ill and will not need hospitalization. In fact, many will be infected and have no symptoms at all. Those with serious illness may need hospital care, including respiratory support. Some of the ways we are preparing at Grand Itasca include rescheduling all elective procedures. We are limiting outpatient appointments to only those that are critical. We are transitioning many of these non-critical outpatient visits to virtual and telephone visits. We have instituted a curbside pharmacy pickup process, so patients do not need to enter our facility. And we are significantly restricting visitors from entering our building. We are partnering with Itasca County Public Health, local healthcare providers, and many others to coordinate the preparedness for our county. At this time, our ask of patients is as follows. If you have known exposure to COVID-19 or are experiencing mild respiratory symptoms, please stay home and self-quarantine. If you're experiencing severe respiratory illness with fever, cough, or shortness of breath, patients should complete a free online evaluation at oncare.org or call Grand Itasca's main line at 218-326-3675. 3401 for guidance. On-Care or Grand Itasca staff will inform you of the next recommended steps to take. Not all patients will meet criteria for testing and may be advised to stay home until they are well again. If a patient is tested for COVID-19, the sample is submitted to the Minnesota Department of Health for testing. Test results can take several days to return due to the volume of samples that are being submitted throughout the state. While awaiting test results, the ill person is isolated to prevent others from becoming ill. If testing confirms a case of COVID-19, the available details and protective recommendations will be shared with that patient and people who have been in close contact with that ill person. We at Grand Itasca are committed to caring for our community. In exchange, we ask you to be diligent about social distancing and staying home when you are sick. We understand that this is disruptive to your lives, but we appreciate the community's commitment to doing what it takes to flatten the curve. We also appreciate the outpouring of support we have received from individuals and businesses within our community. Once again, for free screening, you can visit oncare.org, utilize an e-visit through MyChart, or call Grand Itasca at 218-326-3401. For the latest information from Grand Itasca, I invite you to visit our website at granditasca.org and our Facebook page. For the latest information related to COVID-19 from a state and national perspective, please visit the Minnesota Department of Health or CDC websites. Thank you.